Good morning, everyone. I'm Robbie Wills, the lobbyist for the Arkansas Medical Group Management Association, coming to you this morning from the state capitol in Little Rock. I want to start off by apologizing for not being there in person. Certainly my intent when this conference was scheduled to be there to give you an update in person where you could ask questions and I could hopefully provide some answers. But as you know, the legislative session continues this week. We are not only meeting here today and tomorrow, but probably Saturday as well, as the legislature seeks to wrap up some very important issues that directly impact you and the healthcare providers that you work for and with. I want to start off by giving you an overview of the legislative session, and which will give you an idea of why this session is running long. The session started in the middle of January, the second week in January, and is scheduled to adjourn on April the 19th. Why is this taking so long? Well, for starters, we've had more bills filed in this legislative session than in more recent session. For an increase of 269. Why the increase? Well, that's just a symptom of term limits. We have a lot of new legislators. About a third of the legislature turns over every 2 years, and just as I did when I came into the legislature years ago, everyone wants to make their mark quickly and file legislation to fulfill campaign promises or take care of some issues that are very important to them. So we've just got a big workload, but probably the biggest reason there are some massive issues the legislature has been dealing with this session, some of which are related to health care, and I know that directly impacts you and what you do every day. The first issue I want to talk about is Medicaid expansion. As you may remember, the legislature has been considering an expansion to Medicaid that is provided for under the Patient Protection and Affordable Care Act that basically mandates all of us, everyone out there has health insurance or health coverage of some kind. One way to accomplish that the states are considering is a expansion of their existing Medicaid program paid for by the federal government. The offer on the table from the feds for Arkansas was that they would pay for the first 3 years of that expanded Medicaid program and then gradually draw down the federal expenditures until the state would be responsible for 90% from 2017 and moving forward. To make a very long story short, there was a lot of resistance in the legislature to this, and Governor Beebe, thinking outside of the box, went to Secretary Sebelius at the Health and Human Services and said, in effect, hey, instead of you paying to expand our Medicaid program, how about we take that same pool of money and use that to buy insurance policies for the same people who would have been eligible under Medicaid through the insurance exchanges that are mandated by the Affordable Care Act. Well, this has gotten more traction at the General Assembly than the first option, and it looks like with both legislative leaders in the House and Senate getting on board with this, that this may be well on its way to being law. Now, this would cover about 250,000 Arkansans that currently don't have health insurance, and would go a long way to helping us bring down uncompensated care for hospitals and group practices around the state. It's gone a long way to softening the resistance in the General Assembly, and the Department of Human Services says that they could save the state $670 million over the next 10 years if this moves forward. Now, the trick here is the legislation to enable the private option has already been drafted. It only requires a majority vote of the legislature, but the appropriation to actually spend the money on the private option requires a 3/4 vote. That is a very high hurdle. Legislative leaders are optimistic that they will be able to reach that and make this a reality. That will do several things that I think will be of interest to you. Number one, first and foremost, there will be people who currently don't have health insurance that will have health insurance. Hopefully this will bring down uncompensated care. But the uncompensated care expense. The other thing that this really gets to, and part of the state government's balanced budget proposal originally included a 3% cut for providers in the Medicaid program. Now, my understanding is if the private option is implemented, this 3% cut could be alleviated, lessened, if not done away with altogether. I don't know very many healthcare providers who feel like they could easily do with a 3% cut in reimbursement rates. I'm throwing a lot of information at you. I wish I were there to answer questions on this. There is a website, however, that can give you a lot of information on the private option regarding Medicaid and these health insurance policies. That web address is arhealthandjobs.com. The second big issue that I want to update you on is the Payment Improvement Initiative within the Medicaid program. You will probably recall last fall the CMS and DHS implemented the first 3 episodes of care that will undergo this payment improvement process. Those were upper respiratory infection, perinatal care, and ADHD. Those were rolled online in October of 2012, and the second round has just gone online as well. That's congestive heart failure and hip and knee replacement. Those were active as of February the 1st. If you have any questions about the Payment Improvement Initiative or any issues that arise thereof, you can visit a website. That address is paymentinitiative.org, and that should answer any questions you have there. Now, as far as other healthcare bills, our team has about 55 bills that we're actively tracking that are healthcare related that could possibly be of interest to you. I will provide a bill tracking report to Bobby Riggs, who will forward that to you. If you see any pieces of legislation there that you have any interest in, we will certainly be glad to answer any questions you may have. Just a couple of bills that I want to mention on this video update that may have some interest to you. House Bill 1185, which has actually already been signed by the governor, would authorize pharmacists to substitute a therapeutically equivalent drug that is at a lower cost to the patient when given authorization in the prescription and after discussion with the patient. There's a similar bill that was filed earlier in the session having to do with biosimilar prescription of pharmaceuticals. These things are very likely related. 1185 is already law, though, and I certainly wanted you to know that. There's another bill that we're tracking, House Bill 1190, which requires a Medicaid program to recognize advanced nurse practitioners as primary care providers with a reimbursement rate that's at least 90% of the standard physician rate. This may be of interest to you guys as well. And then House Bill 1881, which is making its way through the General Assembly right now, defines office-based surgery and directs the State Medical Board to adopt regulations governing office-based surgery. That bill was sponsored by Dr. Steve McGee from Conway, where I live, former president of the Arkansas Medical Society. One last thing I want to mention to you that has been asked of me at previous conferences is the issue of tort reform. As you may know, there are competing tort reform proposals working their way through the General Assembly. These will very likely come in the form of a proposed constitutional amendment that will be on the ballot in 2014. You may remember in 2003, medical malpractice tort reform was passed by the General Assembly. However, last year, the Arkansas Supreme Court struck down the heart of that tort reform package from 2003, and when the Republican Party won the majority in the House and the Senate in the last election, it became very clear that there would be some tort reform coming out of the General Assembly. There seems to be movement on that this week. The General Assembly will be meeting this week to refer constitutional amendments out to you. I will update you on the details of that, but I fully expect, and legislative leaders tell me, that there will be a tort reform constitutional amendment on the ballot in 2014. Folks, I've thrown a lot of information at you here today. Again, I apologize for not being there in person, but felt that we were all best served if I were here at the state capitol looking after all of these things that are going on down here that impact you. If you ever have any questions or concerns about anything going on here at the state capitol, please don't ever hesitate to contact me. My direct line is 501-730-4677. And you can reach me via email at rwills@cyberback.com. Once again, thank you for the opportunity to represent the Arkansas Medical Group Management Association here in the state capitol. I look forward to seeing you again very soon.